All right, welcome back. We are here with Morgan Campbell, Laura Packard, and Catherine Sevier. They are answering your questions about health care enrollment and also Medicare as well. This one is a Medicare question. They say, does Medicare pay for hearing aids?
Medicare Advantage programs sometimes do, not all of them do, but regular Medicare does not.
Okay, this is good to know. All right, this person says, I'm 55 years old. I have no income. Do I qualify for any kind of health coverage? I'm thinking that's a Laura or a Morgan question.
There's a possibility to not have any income. We take the household income. So if he's married or she's married, that income can be accounted for, and then she would qualify for a health care tax credit.
Okay.
Depending on their circumstances, they might be eligible for Medicaid, or if they lost their job, they might be eligible for having their health insurance covered through the American Rescue Plan. It really depends on their situation.
All right, this question is, I have stage 4 cancer and did have Medicare, but then they switched me to United Healthcare. Is there a difference? Maybe why did they do that?
So it sounds like as you went into Medicare that perhaps they moved you into a Medicare Advantage program, which is managed by United Healthcare. But Medicare can't switch you out of a government program. They may have advised or asked you to switch to Medicare Advantage from regular Medicare. And with stage 4 cancer, it may be because your pharmacy benefit was better under Medicare Advantage.
Did you have anything to add to that, Morgan?
I think probably what happened is he was placed in a Medicare Advantage plan. And those are certainly great plans as well.
Okay. All right, this person says, my grown child is now 27 and is kicked off insurance. He does not have a job. What should he do to get insurance?
So he can always buy what we call a catastrophic plan, which is a plan that has limited benefits, like you can get 3 what I call sick visits a year. Your preventative care is still covered at 100%, and that's going to be at a much reduced, lower rate than a typical full-blown health insurance plan.
Okay. This person says, just to clarify, I signed up for Part A Medicare at 65, but since I'm still working and have insurance through Blue Cross Blue Shield, I did not sign up for Part B. When do I need to do that so I won't be penalized?
As soon as you retire or lose that employer benefit, you need to sign up. And there is a window there, so do it immediately or do it as you anticipate getting ready to retire.
All right. Laura, this person says, what about people who are already enrolled in the ACA healthcare plan? Do we need to re-enroll again?
Well, at the end of the year in the next open enrollment period, you'll want to look over your options for next year. You may or may not be auto-enrolled in the plan you have now for next year, but it's always worth the time to shop and make sure your plan is best for you.
Yeah, because things change, and just because you had something last year doesn't mean that you want that same one this year. This person is asking.
You want to make sure you update your income too.
That's a good point. This person is saying, I have Medicare A and B. Can I get a supplement insurance as well?
Yes, absolutely. Medicare does not cover anything or many things 100%. So you may want to get a supplement to take care of the portion that Medicare does not cover.
All right, this is, does Medicare offer mail order prescriptions?
Depends on your if you're a Medicare Advantage, possibly. Standard Medicare, no.
All right, this person says, what do you do at 62 for insurance help?
At 62 with no Medicare in place due to disability, you would go through the marketplace and get a tax credit if you qualify for one and purchase your health insurance there.
Okay. And this person says, do I sign up for Medicare Advantage at the same time I sign up for Medicare A and B or at a different time?
You sign up for either Medicare A and B or Medicare Advantage. So you have to make a decision when you do sign up. But again, 65, 3 months before, 3 months after.
All right, this person says, if you don't take Part D because you have employer coverage, then when do you have to get it without a penalty?
You can get Part D without a penalty. Once your employer coverage ends, you immediately need to have a Part D up and running the very next day.
Okay, all right. We have taken many a question. This last one is, my birthday is December 5th and I'll be 65. When should I apply for Medicare? 3 months before, 3 months after. You got 7 months to do that. Thank you for sending your time and expertise. We appreciate you spending your time and expertise. Thank you for taking those questions to the text. If you missed any of these or you want to hear them again so that you can be sure of what you heard, we want you to go to the 2 Wants to Know section.